Does my child have whole body apraxia? That's another very common question that I get from parents who are starting to dig deeper and learn more about complex autism and motor challenges. But here's the problem. When you Google apraxia, you will probably see apraxia of speech, but there's also acquired apraxia, dyspraxia, developmental coordination disorder. It's confusing, even for professionals. So today we're going to break it all down. What exactly does your child have? Can you get a diagnosis? And what's the best way to support your child to move more intentionally? So by the end of this video, you're going to understand why everybody is so confused by the word apraxia. We're going to talk about what DCD, or Developmental Coordination Disorder, is and why it's being used as the umbrella for motor impairment in autism. We're also going to talk about why your child's motor challenges are actually bigger than apraxia and what's currently being done to educate and push the system to change. And be sure to stay with me until the end, because I'm going to share my list of ways that you can advocate at school and with your providers who might not yet know or understand whole body apraxia. Hi, I'm Dr. Dana Johnson, an occupational therapist with a PhD in child mental health and development. And over the last 20 years, I've worked with many families who have children with complex autism, and I've helped them to understand the motor challenges that often go far beyond speech. My goal is to clear up the confusion around apraxia so you can finally understand what's really happening in your child's body and how best to support them. So let's start off with some terminology, because this is where many families get stuck. First, apraxia. So apraxia in general means a difficulty carrying out purposeful movements even when the individual understands what's being asked. It's essentially the inability to put your thought or idea into action. Then we have childhood apraxia of speech, or CAS, and this is a speech-specific diagnosis made by a speech-language pathologist. It affects the mouth and jaw motor planning needed for speech production. But most non-speaking autistic individuals have motor challenges far beyond just speech, and challenges that are more involved with the entire body's coordination, sequencing, and sensory integration. Next, we have dyspraxia, a term that came out of the UK and is typically used by occupational therapists. This is when an individual is clumsy or has uncoordinated movements. And it's also actually called Developmental Coordination Disorder, or like I said, DCD. Now, I'm going to go into much more detail on this in a few minutes. And finally, there's something called acquired apraxia, which is what happens after a brain injury or stroke, and you lose your ability to put your thought into action. Now, here's the thing. All of these types of apraxia that we just talked about, except apraxia of speech and developmental coordination disorders, are actually considered symptoms and not a diagnosis. Apraxia is actually not in the DSM-5, which is the diagnostic manual that doctors use to diagnose their patients, as a standalone diagnosis. So apraxia in and of itself is not a diagnosis. So when parents ask their doctor about apraxia and get told, well, we don't diagnose that, they're actually telling the truth, because apraxia is a symptom of something else. Now, here's where the story shifts even more. So I talked about developmental coordination disorder, and that is a diagnosis in the DSM-5, and it's used when a child has motor impairment that's not explained by another condition. So it's difficult to apply to autism because the child already has that diagnosis, and getting that diagnosis isn't as straightforward as we would like. It is possible, though. However, for non-speaking autistic individuals, this process can be very difficult, not because the motor impairment isn't there, but because assessments aren't designed for individuals who struggle to initiate their body or have complex sensory processing challenges leading to significant dysregulation. There are more college programs that are explicitly teaching that motor impairment in autism should be classified and documented as developmental coordination disorder. And that's progress, but the terminology and professionals still need to catch up. Many therapists therapists, especially those trained 10 plus years ago, like myself, never learned about developmental coordination disorder or motor planning impairments that are specific to complex autism outside of gross and fine motor skill delays. So as a result, we see a gap in understanding the full picture of the client. Now, diagnoses like apraxia of speech or developmental coordination disorder sound neat on paper, but they don't actually capture the full picture of the clients that I work with. Brain imaging tells us that autistic individuals with complex motor profiles look neurologically different from people who have developmental coordination disorder without autism. Different motor networks, different sensory feedback loops. So when both are placed under one umbrella, we lose precision, and many autistic individuals end up being misunderstood. And while developmental coordination disorder or apraxia of speech focus on motor planning, complex autism involves so much more. For example, it could be complete disruptions in sensory input and feedback. Abnormal or missing body schema, what that means is a difficulty figuring out where the body is in space. We see global, fine, gross, and postural motor impairment, not just movement planning. We see high anxiety and complex medical issues. When professionals call it simply apraxia, they often miss those deeper, system-wide motor issues. It's like treating a leak in one pipe when the whole plumbing system needs to be realigned. Now, a growing number of researchers and clinicians, myself included, are advocating for motor impairment to be recognized as a core feature of autism and not just a co-occurring condition. I'm also working to define the unique neuromotor challenges seen in complex autism because this profile is distinctly different and deserves its own definition, assessment, and intervention framework. The current tools simply don't capture what I see in my clients every day. And the lack of appropriate intervention exists because this profile has been misunderstood for far too long. I'm working to change that and to make sure that these individuals are finally seen, supported, and understood. I use the term whole body apraxia because it captures the reality that these symptoms affect the entire body. It's far more than just simple clumsiness or lack of coordination as seen in dyspraxia. Individuals with whole body apraxia want to move their bodies and do understand what's being asked of them. The challenge lies in the neurological disconnect that prevents the body and brain from working together to complete the action. Until the DSM-5, or the Diagnostic and Statistical Manual, officially changes, we have to work within the system's current language. And that means using terms so your child can access services, while also educating every team member about whole body apraxia and the individual needs of your child. Okay, so what do you do as a parent? First, understand that your child's whole body apraxia is not the same as speech apraxia, acquired apraxia, such as after a stroke or a brain injury, or even the classic dyspraxia. It's broader. It involves how their brain organizes and executes movements across the whole body. Second, when you talk with professionals, use language that they recognize, but also use this opportunity to educate them. Remember that assessing individuals with complex motor needs is challenging, and the majority of providers still don't know how to do it. Third, share educational content like this video with your child's therapists, teachers, and doctors, because sometimes the fastest way to change the system is having one conversation at a time. Fourth, one of the best things that you can do is to support your child with exercise. And don't forget motor coaching or helping their body work through the steps involved in the task. Exercise I love because it provides the sensory feedback to build intentional movement. Make sure to focus on functional movement patterns that are slow and controlled. And if your child is over 10, consider working with a personal trainer that can help build those intentional movement patterns that traditional therapy alone might miss. And always focus on gross motor foundations before fine motor skills. And don't forget, force grading, or the ability to apply more force or less force to something, is also intentional movement, as is pacing, initiation, and regulation. They're all part of intentional motor control and can be practiced for better body control. Okay, let's sum this up. First, apraxia by itself isn't a formal diagnosis. It's a description of a motor planning issue. Second, apraxia of speech is speech-specific, and developmental coordination is the actual recognized diagnosis, but when there is no other diagnosis or condition involved. Third, in autism, challenges go way beyond coordination, and in my opinion, even the term apraxia. They actually involve much more, the entire sensory motor system. Fourth, the terminology is so confusing, but you can work within it strategically while still advocating for the truth of what's happening in your child's body. And finally, change is coming, even if it's slowly, through advocacy, education, and parents like you asking better questions. If this video helped you finally make sense of all the mixed terminology around apraxia, let me know. If it brought up more questions, please comment and I will respond. Share this with another parent who's also asking, does my child have whole body apraxia? And make sure that you subscribe so you don't miss the next video. Thank you, and I will see you on the next one.